Good afternoon, everybody. Welcome to another edition of the AFR EMS case studies. My name is Chris Ortiz. I'm the EMS Division Chief for Albuquerque Fire. Today joined by our Medical Director, Dr. Kim Pruitt.
Hi, Chief.
Doc. And also Lieutenant Steven Siebert.
Hey, Chief.
Thanks for joining us. So we're going to talk about a interesting and common case is a pediatric seizure. So you obviously, LT, are assigned to Rescue 12, and you responded to a 12 Delta for a 1-year-old child who was seizing. Obviously, we always get a little more amped up when it's the pediatric calls, but talk to us a little bit about what you're thinking en route to that call and how you prepare.
Sure. I remember we got sent to this call. I think we had just cleared another one, so we were on our way. So usually with the PEDS calls, depending on how the call comes in, I always try to pull up the protocol, and as my driver and I were getting there, go over the medication dosages and just kind of talk through it with him so that we're both kind of on the same page before we actually get to the call. I feel a lot like this winter and just kind of flu season, like we run a lot of like pediatric seizures, and so we kind of just like talk about it, and a lot of times we go to these calls and we get there and the seizure's already stopped, and it's just kind of like bringing them out through that post-ictal phase and talking with parents and being reassuring and calm for them. So, but always having that knowing the right dosages and things like that in the back of our heads.
That's great. That's one of the things we talk about a lot of these podcasts is having those guidelines accessible so you can review it on the way to the call. You're not having to flip through books like the old days and have it right at your fingertips. So that's fantastic. That's good to hear. So in this case now you guys got to a single family residence. Talk to us about what you saw when you got there.
Sure. We walked in this call back in the back bedroom. Mom was on scene. I think it was like an 18-month-old kiddo was just laying on the bed having a full grand mal seizure. He was still going, so right away we started assessing him. We got some blow by oxygen going, kind of trying to start get the history from the mom, how long the seizure had been going, how many seizures he'd had, history of seizures. And for this particular kiddo, it sounded like he had a history of febrile seizures, and she said that this happened before in the past where he had to be transported and he had to be given medication for them to stop by EMS. So the seizure had already been going since she called, and so it had been 5+ minutes already. So then we started looking at our medications. So we ended up giving Versed IM in his thigh. And he ended up stopped seizing. The rest of his vitals are pretty normal. His blood sugar was normal. And then Albuquerque ambulance got there. We ended up riding in with the Albuquerque ambulance. We took him in his car seat. The kiddo started having another seizure, like right when we were loading him up, maybe lasted about 30 seconds. And he was pretty lethargic for the rest of the time we had him. We pulled up to UNM, gave them the radio report, and he started having another seizure, like pretty much right when we pulled him to the ambulance base. We went ahead and gave him another dose of Versed. Took him into PEDS-ER. He continued to seize for a while there, and they gave him a few different medications, and he kept seizing, and eventually they got him to stop.
And these weren't continuous, so he would have periods where he was lucid or at least stopped seizing, or was it one continuous from the time you got him to the time you dropped him off?
From the time we got him, he was seizing until we got him the Versed. And then he had one that lasted about like 30 seconds there and then stopped. And then pretty much right when we pulled in UNM, he started having another one.
So all told, he had 2 witnessed from you guys and then the 1 initially?
Correct,
So
yes.
3 total.
Yeah.
Wow, okay. Now, going back to your initial assessment of that patient, I know Mom had elicited that he had had febrile seizures in the past. Did she tell you that he was sick now or was having any recent illnesses?
She had mentioned that he kind of had a cold that day. It seemed like kind of just like runny nose, just like normal kid sick stuff. But she didn't report like any fever for him on that particular day. And she also said that he had some type of brain tumor or cyst that they've been kind of looking at with the neurologist, but they've been having a hard time getting in to see the neurologist. So there was that kind of in the back of my head is, is this a febrile seizure? Like, does he have a fever right now? Did he present as sick, or could this be something else being caused by something that we can't see?
Mm-hmm. Initial vitals, we had a couple different documented temperatures. Was he febrile? Did he feel hot to the touch? And did he have his temperature?
Yeah, I think he felt warm to the touch when we first got there. I remember my driver saying like he feels like hot. And then our thermometers are, I feel like they're pretty hit and miss. So that's kind of like the hard thing. But usually when they do read high, they do have a fever.
Yeah. We always talk about, too, how using the parents, especially moms, will know, like, even if they don't have a thermometer,
Right.
they know when the baby's temperature changes. So always using that as a guide. So good job on that one. So talk to us about the pre-plan of the IM Versed. What dose did you end up giving for Versed? Can you tell us again?
Yeah, so when I was drawing up the Versed, it took me a minute. I was kind of struggling like with the right amount of volume for the dosage. So we put him at 15 kilos, so our protocol says 0.1 milligrams per kilogram. So we're going to give him a total of 1.5 milligrams. And I was drawing it up, and our Versed comes in 2 milligrams, or 10 milligrams in 2 milliliters. So when I was doing all that math, like I kind of got thrown for loops. I'm like, oh, let's just do the Broswell tape and double check. So we threw the Broswell tape down, but it turns out the Broswell tape is a different dosage than our protocol. I believe the Broswell tape told us to give like around 0.7 mLs. So I drew up the 0.7. I was looking at it. I'm like, this doesn't seem right for 0.1. I was kind of started doing the math in my head, and I finally got to like we needed to give 0.3 mLs of the volume would be equivalent to the 1.5 milligrams. So once we kind of like figured that out and talked about that with me and my driver, we gave it. So there's like a little bit of a couple minute delay, like we were figuring that out. So, which is always kind of stressful. Like when you're trying to figure out this math and you have this kid who's actively seizing, you have mom who's pretty amped up. And so like that's like definitely like heightens the stress level on these calls. But our guys are super great, and they do a great job of staying calm. No one was panicking. No one was freaking out. Our engine captain, he was kind of running some interference, just being reassuring to the mom, and we ended up giving the right dosage, and so
That's a great job.
Well.
Yeah, that was awesome. And we talked about that because that had been brought to our attention before about the discrepancies between the Broslow and what our formulary says and the guidelines. And we brought it to Doc, and we're looking at possibly, as opposed to changing the guideline because she's more comfortable with that dose, is just using the Broslow as a guide for sizing and then sticking with our formulary. Is that correct, Doc?
Yeah, I think in general, like the 0.1, any med we give to kids in general is like a 0.1 mg per kg, and it's easier to remember it, I think. The Broslow, I need to look into it a little bit more honestly, but we tried to overcome the dosing questions with the chart, the colorful chart and the references where it should give the mLs
Right.
as opposed to the mgs.
Yeah, and inside the protocol, I figured this out after, but under the formulary, there is that pediatric reference chart that is color coordinated, and the color is correct on that chart, and that dosage is different than what's on the actual tape. So if you go by the chart under our guidelines, it is correct.
The chart should be correct
Right.
because we just finished updating that. So in general, I think our guidelines are right where they should be. Now, it wouldn't have been wrong to go with the Broslow. There's definitely a spectrum where you can treat, and I don't think anybody would have faulted you for that. But I really appreciate you taking the time and the step back from a really intense situation to do your cross-check, double-check the math, and then also double-check the guidelines.
Yeah.
Yeah, that's a great job. So going back, we were able to treat it with the first dose of Versed, and we talk about giving it IM as opposed to intranasally, especially with the kiddos who've had cough, congestion, not feeling well, just because they have all the mucus and everything in there. It helps with absorption. So you guys did a great job of doing that. Did you guys check blood sugar in the patient as well?
We did, yeah. I think it came back as like 171, I think.
Yeah,
So his
like-
blood sugar, so it's fairly normal.
Yep, and realizing that's important for these kiddos, so you guys did a great job. Doc, what are some of the other things that we want to keep in mind when we're talking about these patients who appear to be febrile seizures? We're assuming that based on the history we get from the parents, but what should we be have a heightened alert for anything else?
A couple other things to think about, especially when they continue to seize and they've had one seizure and they do have a fever and then they have another one. I tend to take a step back at that point and say, okay, what else could this be besides just a febrile seizure? Because at this point, it's pretty complex. And so, unfortunately, one thing we frequently need to think about is non-accidental trauma or child abuse, shaken babies, or a head that's been hit with something, or in this case, even maybe a mass in the head, a lot of times any kind of brain trauma can actually cause a fever itself. An injured brain can stimulate a fever. So it's just something to think about at that point. I tend to like to expose the child and look for bruising or other suggestions of maybe potential non-accidental trauma. And then the other thing with these toddlers, the ones that are just getting mobile and close to 2 years old, especially the boys, they tend to love to put things in their mouth. So the other question I usually ask myself is, could this be an ingestion of some sort? Could they have gotten into grandma's meds? That's why the checking the sugar, just like you did, is important, or considering some sort of toxic exposure. And again, unfortunately, in this day and age, fentanyl is not that uncommon for these 2-year-olds to get into. And maybe considering Narcan or something like that. But this doesn't sound like a hypoxic seizure at all.
No. His stats are pretty good for the whole time, especially with the blow-by. We kept him up at 100%.
Super. And the respiratory rate sounded like it was fine. So not something to think about here, but good to just keep on the radar for the future.
No, I appreciate that. And when you look through the interventions that you all did, I mean, we're talking about oxygen right off the bat. Yet that SpO2 is maintained to that 100%. You gave midazolam 1 dose, stopped the seizure, had another seizure. You repeated that dose. You did absolutely check the sugar, absolutely everything that you could have done to treat this patient. It was interesting. This is one of the cases I believe we were able to get follow-up on, right? And it sounds like patient obviously was still seized in the ED. They were treated for the status seizing. They were intubated and admitted to the PICU. They did have a negative head CT, which was good. Their blood work looked good. And ultimately, the final diagnosis was a complex febrile seizure that was caused by a virus. And they were extubated and sent home a couple days later. So everything that you did was spot on, exactly the course of treatment that led to a good outcome for that patient. So I think it was an absolute great job.
Yeah, thanks.
So we've already talked you up about how fantastic you did, but tell us what information or what nuggets would you give another provider who encountered this same call, things that you took away from that you'll add to your experience?
Yeah, I think there's a few things. I think one of the big things is really just being able to stay calm in stressful situations. I think that when we ourselves get amped up, like it really hinders our ability to think clearly. That's one thing that our crew does very, very well in stressful situations. Everyone's just super calm, level-headed, no matter what's going on. And I applaud those guys for that, for them. And then just kind of just being on top of your protocols and knowing like what your dosages are, and then not being so concerned. Yes, we do need to stop the seizure, but yes, we also need to give the right amount, the right dosage of our medication, and being able to just like take a minute and give the right dosage. I looked at that, the pediatric dosing chart afterwards. I kind of looked through that more. I'm like, oh, this is like a great reference, the pediatric dosing chart, because that literally has every dose of every medication that we'll give to kiddos, and it'll tell you the exact milligrams and then the milliliters that you need to give. And then one thing I kind of started doing after this call, just because I felt, personally I felt rusty as far as me drawing up my medication, getting the right dosage in a timely manner. So something I started doing when I come in the mornings, I'm kind of doing like just getting everything ready to go for the day. I'll just go through the formulary, pick a medication, and just do a practice dosing. So whether it's like an epi or Versed or just whatever, and usually I'll do like the kids' dosage. Just kind of just do one in the morning. It takes 2 minutes, and just kind of one of those things that helps keep myself kind of sharp, and just hopefully that'll help me be able to give the right dosage quicker on the next one.
Yeah, perfect.
Yeah.
That's great. That's a good takeaway. And I appreciate you coming to talk to us about it today. You guys did a fantastic job, so spread the word to your crews. And we really appreciate you stepping up and doing this.
Thanks, Chief.
All right, so that's it for today's session. If anybody has any cases they would like to submit, use the SharePoint tab under the EMS page, or you can reach out to the 7-8. And until then, we'll see you next time. Thank you both.